Hello everybody, it's Martha, and today I want to talk about medication reconciliation. As we know that when anybody goes out to the hospital, they may have a change in their medications, or if they're coming back in, they may have a change of medications. So the process that you're going to use to make sure that you reconcile these medications and that these medications are appropriate and what the resident should have will be drawn out in this video. So medication reconciliation is the process of comparing med orders to what they have been taking and what the new ones will be from the hospital. So let's break it down to 5 easy steps. First, we want to get a list of the meds that they were on when they left, right? When they left the home. So you can print out a list that would have said something, it'll look a little something like this, from PCC, and you'll get that, and then you'll get something from the hospital, a medication list on what they were on, right? Now, when you gather this information, you want to compare them. You want to look for added meds. You want to look for meds that weren't given, or meds that, did they stop it? Did they change the dose? On the medication list from the hospital, they'll have certain things. I've blacked this out, but you'll see certain things like on the side there. It'll say continue, it'll say stop, it'll say start. So some of them may be new meds, like say I was getting an IV antibiotic in the hospital and now I'm coming to the skilled facility and they want me to change it to PO. So you may see something like that. So when you go through those, the ones that are discontinued, yellow those out. Don't look at them because they said discontinued, right? So compare what's on here on your hospital discharge to what they were taking in the nursing home. Now, all you're doing right now is gathering the information. After you have gathered this information and compared the two, you want to figure out the questions you're going to ask after the comparison, right? And that's when we call the doctor and we confirm the orders. Now, I would say, doctor, they came from the hospital and they want them to start on this Ceftin 300 milligrams for 10 days. Okay? It says, okay. They also were on baclofen, bisocodyl at the hospital, giving them the dosages. Okay, yes, continue those. Okay, and then I was looking, doctor, and before they were on the B12 Q month. Do you want to also continue that? They didn't do it at the hospital, and he'll say yes. Now, if I say, well, it looks like they changed the baclofen from 20 milligrams he was taking here to 90 milligrams at the hospital. Do we want to continue that? And he might say yes, he might say no. So if he says no, I want you to take your pen and write it on here, MD changed to such and such, and you write the date. A doctor at the hospital, they were giving, bisocodyl PO, but we had it as a suppository. Should we change that? Yes. Change it to suppository. So I'm going to get my pen. I'm going to write change it to suppository. Once I have all of these orders done, and your sheet should look messy. It should be a worksheet. You ask the doctor, you got everything, and you know how it is. Not messy enough where you can't read it, but where you know that you've verified and you've looked at everything. Then you're going to go into PCC, and you can pull up previous orders, but you're not going to click all of them. If you click restart all the previous orders, it is going to give you so many mistakes and so many duplicates. That's not what you want. So you want to do it just like before. You have your list now. You know exactly what they're supposed to take. You can go through PCC and see if it's there from before, and if it is, you can restart it. But I want you to go one by one. This is the only way to do it, and it's the safest way for the patient. You're going to go one by one, and you can start that one. If the next one's not on there, then you can add it per an order, right? We all know how to write orders in PCC. Once those are done and you verified, go back through your list and make sure that you've gotten them all on there. and then your medication reconciliation will be complete. This is so important. We can't miss this, guys. You cannot take any shortcuts around it. Just take your time and make sure you get those medications right. The patient's safety is of the utmost importance here. Thank you.